So let's get started with chapter 7 of the EEGucation application. So we've done a number of chapters previously. I think we've covered waves and frequencies. We've covered chapter 2, which is some normal patterns. So I'll start with chapter 7 today. So a few things about this application, those of you who've used it and those who've tried a beta version, you can expand it and you can get a better enlarged view of the EEG that is under review. The question is here, so this is the select biplets, so you have to select out of those four. This is for expansion. If you click on the slide, if it is the correct answer, you'll get a correct pop, otherwise you'll get a wrong answer. And if you get the correct answer, then it will switch to the next slide. So let's look at the different options and let's start here. So the question was select biplets. You do not see periodic lateralized epileptiform discharges here. Odd numbers record electrical activity from the left side, even numbers from the right side. So you do not see any epileptiform discharges. What you see on this EEG is an excess of beta activity. So these green lines are separated by 1 second, and there's a lot of this beta frequency, which is a frequency that exceeds 13 hertz, so 13 cycles per second. So this has a lot of beta activity. This is something that you will see with excess use of benzodiazepines or barbiturates. So this is not the correct answer. What about this one? Let's expand it. So there's somewhat of a periodicity here, but this is not something that will qualify for biplets, which stands for bilateral periodic lateralized epileptiform discharges. And when we get to the right slide, I'll talk more about that. So what you see here you see these triphasic waves. So these waves here, frontally dominant, highest amplitude is in the frontal head region. So there are 3 phases to it. There is the first phase, second, and the third phase. Does not show very well on this specific slide, but we've had a tutorial on triphasic waves in the past, so you can review that. Now, before we move on, let's go back to this slide. So triphasic waves are most often seen with hepatic encephalopathy. You can see that with uremia. You can see that with carbon dioxide retention. So someone who has any kind of a respiratory condition where they are not able to completely get rid of the CO2 and there's CO2 retention, people can get triphasic waves. You can get triphasic waves with mixed edema coma. You can get that with lithium intoxication. So it's a non-specific pattern. You can think of a few conditions, but you cannot make a diagnosis just based on this slide. What about this one? You see slowing. So between 2 green lines, you only see 2 waves. So this is delta activity and some theta activity. So this is a mixture of delta and theta activity, but you do not see periodic discharges here. So this is a non-specific pattern. And so this leaves us with this slide, and what you see here, you do see some periodicity. Now the difference between PLEDs, which is periodic lateralized epileptiform discharges, and bipleds, which is bilateral periodic lateralized epileptiform discharges, is that these are discharges that are seen obviously on both hemispheres, but are asynchronous. So if the discharges were synchronous, you would have called those GPEDs, or generalized periodic epileptiform discharges. So these are asynchronous, but these are bilateral. So you call these biplets. And if you see biplets in patients who've suffered a significant anoxic brain injury, this is a poor prognosis for functional recovery. So we'll select this one, and we've gotten it right. And this moves us to the next slide. So what's the question here? Select EEG in Lennox-Gastaut syndrome. Let's just quickly recall what do you expect to see in patients with Lennox-Gastaut syndrome. So Lennox-Gastaut syndrome is an electroclinical syndrome where patients are developmentally delayed. They have multiple types of seizures. They have generalized tonic-clonic seizures, they have atonic seizures, they have myoclonic seizures, they have tonic seizures, and the EEG pattern shows background slowing, and you can see slow spike and wave discharges, which is 2 to 2.5 hertz spike and wave discharges. And if you look at the sleep, you see paroxysmal fast activity. So let's go on to this slide. In fact, you see an electrographic seizure here, which is starting from the central head region. So this is not a pattern, although you can see seizures like this in patients with Lennox-Gastaut syndrome. This is not a defining feature. This EEG is not defining of Lennox-Gastaut syndrome. What about this one? You see some occipital spikes, occipital sharps. Again, this is not a defining EEG for Lennox-Gastaut syndrome. What about this one? So this is something where you see the slow spike and wave discharges. So these are the kind of slow spike and wave discharges that you can see with Lennox-Gastaut syndrome. So this is the spike and this is the wave that follows. And it is between two green lines, you see 1 to 2 waves. Over here 1.5 to 2 hertz frequency. So this can qualify for Lennox-Gastaut syndrome. This is what we will select, and we've gotten the right answer. Okay, so this is a simple one. Select rapid eye blinks. I'll get to the answer right away. In fact, these are the eye blinks. So when identifying eye blinks, you look at the frontopolar electrodes. So FP1 and FP2 are placed on the forehead, and you see this very rapid eye blink artifact and a sudden drop in the gradient between the anterior electrode and the one that's just posterior to it. So this qualifies for rapid eye blink. Don't call these epileptic spikes. And we'll select this, and we've gotten the right answer. Select muscle and movement artifact. That's a simple one. In fact, this is the answer. I can expand and show it to you later. So this is muscle artifact, and this is here is the movement artifact. So this would be the right answer. But let's have a quick peek at the other EEGs here. What do you see here? So this is a pattern where you see slow activity, and there is a electrode pop there. So this person is most likely asleep. What you see here is sleep spindles, which are asynchronous. So asynchronous sleep spindles can be normal in infants up to around 15 or 18 months of age. So these are asynchronous sleep spindles in an infant. But if you see asynchronous sleep spindles in an older individual, then this is considered abnormal. And what do we have here? So this is the similar EEG that I'd shown you previously. There is a lot of fast activity, something that you can see with benzodiazepine use or barbiturate use. So the correct answer, select muscle and movement artifact. So this is the right one. I'll select this and we'll move on. Select childhood absence epilepsy. So what are the EEG findings on childhood absence epilepsy? Let's review this one. So this EEG basically shows a burst suppression pattern. This is a burst. This is a period of suppression. So if you see a burst suppression pattern in someone with anoxic brain injury, it's a very poor prognosis for functional recovery. In a young individual with epileptic encephalopathies, you can see a burst suppression pattern, but this specific pattern can be seen in something what is called Ohtahara syndrome, which is an epileptic encephalopathy. So this EEG is from a patient with Ohtahara syndrome. This pattern here, this is one of the seizures that you see sometimes in patients with Lennox-Gastaut syndrome. So you see an onset of the seizure, and this actually is a seizure. And this EEG shows, so these two green lines, just for recollection, are separated by 1 second. You see 3 of these spike and wave between that 1 second. So this is a typical 3 per second spike and wave pattern that you see in patients with childhood absence epilepsy. So the correct answer is, this is the correct answer. You got it right, and we move on. So there are quite a few slides, so I will stop. We are getting to 10 minutes, so I will stop here. You can, once you've done the application, you can always check your scores. So if you go here, the correct answers and the wrong answers, it will show you the progress. So we've only completed half the slides. So it will give you the time elapsed, how much time it took for you to complete that chapter. And I'll keep adding more slides, so you'll be able to have a look at more slides. Very well, thank you. I'll see you at the next tutorial.